Welcome to the Trojan Health Show, where we want every Trojan to fight on in perfect health. I'm Shari Horton, and together we're going to get some questions answered about occupational therapy. Today, we're going to get an understanding of what occupational therapy is. Our OT correspondent, Brittany Frederick, sits down with Dr. Camille Dieterle and discusses a therapeutic intervention called lifestyle redesign. And then we'll be sitting down with Dr. Catherine Crowley, who will be answering our questions about occupational therapy. So here's the clip discussing lifestyle redesign.
So this is our clinic here in Newengeman. This is the occupational therapy faculty practice where we have all of the lifestyle redesign programs for students. So we've got a few different offices, and in each of our rooms, they're really simple because when you come in for lifestyle redesign, it's really just kind of a conversation. So we have a few of these rooms are in session right now. But this is my favorite room because it has a view. So we're facing north here. And this is where we have groups, but also one-on-one sessions with our students. And it's essentially like a life coaching, kind of like life and health coaching. And it's available to any student and covered by student health insurance, which is really cool.
Okay, so Dr. Dieterle, we're here in the Occupational Therapy Center, and what services does the faculty practice offer students?
So we offer life coaching and health coaching for any student, and within that coaching kind of practice, we mostly see students for stress, just when everything is kind of freaking out. So stress management, weight management. We see students with chronic pain, chronic headaches, and a lot of just kind of like getting organized. We see a lot of students having trouble with procrastination, feeling disorganized, feeling like their life is out of balance. Sometimes we have students that actually have diagnoses, something like ADD or mental health type of diagnosis that's just making it more difficult to stay on top of things. But we can see any student that's just wants coaching.
So the coaching process is through this intervention model called lifestyle redesign. How does that work?
So lifestyle redesign was developed here at USC at the Occupational Therapy department. And just because so many people don't know, occupational therapy, it sounds like it's like job therapy or something. It's a very confusing name, but it really just looks at how do you occupy your time and how does that affect your health and your happiness. So lifestyle redesign is a technique within the field of occupational therapy that helps you to change habits and routines to get more basically what you want out of life. Like you might have a specific health condition, like let's say overweight or obesity. So you're trying to change habits and routines to modify your weight. Or in the case of like a typical college student, you might just be kind of stressed out and disorganized. And so we work on different habits and routines that you can do, really small changes in your day-to-day life to just make things easier.
How does a student know that they're showing signs that they could benefit from lifestyle redesign as opposed to another service, maybe like counseling?
So with counseling, usually it's more of an emotional type issue. It might be from the past or just something that's kind of more psychological in nature. And with lifestyle redesign, it's really about the practical here and now, about the typical things you do in a day, like for example, eating healthy, exercising, socializing, not too much, not too little, studying routines, sleep, all these kind of like components that make up like a balanced day. We help students get that optimized so that they can be the best that they can be, the best student, and also reach all of their goals, whether it's personal goals or academic goals.
How does a typical first meeting work?
The first session, we want to hear about what's challenging, like what's kind of going wrong, you know, what needs to be changed, and what are the goals. So often we see students where they are feeling like really behind in their schoolwork or overwhelmed, or maybe a similar thing even in their social life, like maybe they're feeling kind of overwhelmed or like it's not very fulfilling. Or maybe their health, they're having like a health issue that needs some attention. So in a typical session, we're going to find out what's the challenge, like what's most challenging, what are barriers, like what makes it hard to change that, and then we start to create strategy around what could be changed in your day-to-day life that's going to make things better.
And so how does it work? Is it group or individual meetings?
Typically, most students want individual meetings. We've had some groups. We have some weight management groups, and we've had some young adults with chronic pain groups. But most students like the convenience of just being able to schedule it whenever they want, and having that one-on-one time can be incredibly valuable.
How long does treatment typically last, and how many sessions would a student go to?
So a typical session is an hour, but it could be less. And some students come in for a couple sessions and they take away some really powerful tips, and then they're on their way. And then we have all the way on the other end of the spectrum, we have students who see us once a week for years, you know, almost their whole time here, because they just really like that coaching. It keeps them on track, it keeps them accountable, and it keeps them setting and reaching their goals.
What are some of the techniques that you might use? I understand that you're a certified yoga instructor. Do you use yoga?
When students come in and they really want to work on stress management and being able to relax, sometimes we have students who are having anxiety and other just like high stress kind of situations. I will use yoga relaxation techniques if the student's interested. It really depends on what the student's interested in. We're going to follow their interests. We don't just like impose things on people. It's really about finding out what is meaningful and engaging to that student and what's going to be motivating and interesting to them. So some students just happen to be really into yoga, and so we do some yoga. But some students not at all, so we do other stuff.
And what you just said, that's basically the premise of occupational therapy, right? Looking on an individual level about what's meaningful to this person, what gets them going, what makes them feel like a meaningful member of society.
Absolutely.
Now, if you did yoga or maybe some other activities, is everything confined to this office, or where else?
No. So that's one of the really cool things about occupational therapy is we can work with our clients anywhere, essentially. So I've had sessions where I was riding bikes with my student clients, going to the Lions Center, going to dining halls, dorm rooms, grocery stores. We really like to go out into the community where we're engaging in activity to look at, you know, what's really happening and how can we get student moving forward.
Are visits covered by student health insurance, and what about private health insurance?
Yeah, so the USC Student Health Insurance covers lifestyle redesign for students under occupational therapy. And then for students who have different insurance, we just can check it individually. So we'd have to just check with our receptionist, and she would check their benefits and be able to tell each student what exactly their benefits cover for occupational therapy. Most insurance plans cover several sessions every year. So
I understand that you offer a service called OT on Call. How does that service work?
So OT on Call is a way to quickly ask questions to one of our occupational therapists and find out if OT is a good match, if this kind of coaching approach is a good match. So we have an email address that's really easy, otoncall@usc.edu, and you can write in like any questions and we'll get back to you quickly. And then we also can do just free 15-minute phone consultations where if you want to just find out a little bit more and talk about what you're specifically wanting to work on and see if it's a good match, we can do that as well. And that phone number is 323-442-3340.
Okay, great, thank you. Just kind of a last question. If a student, they can feel they're in a different environment, being in college, there's different schedule, different routine, what would you say, how would a student identify that, lifestyle redesign is something that I need? What are some of the questions that a student might ask themselves to be able to determine if they could benefit from lifestyle redesign?
One question would be, do I have a goal that I don't know how to reach? Am I having trouble just kind of feeling good in my typical day? Getting enough sleep, eating well, exercising. Am I just feeling good in my routines? Another question is how often am I getting sick? Am I having more serious issues with my health? That would be a time to look at things. How's my focus? Do I feel focused? Do I feel on track with my academic work, with all aspects of my life?
Thank you so much for joining us to find out more about occupational therapy and lifestyle redesign. Back to you, Shari.
Thank you to Brittany for that engaging interview. We are now joined by Dr. Catherine Crowley and Mindy Lee. Dr. Crowley has been an occupational therapist since 1974. She received her master's degree in occupational therapy at the University of Illinois at Chicago. In the 90s, she came here for her doctorate at USC's Department of Occupational Science and Occupational Therapy. She teaches full-time in the divisions minor in our occupational science program. Accompanying Dr. Crowley is Mindy Lee, who's a master's student in occupational therapy. Thank you so much for being with us, Kate.
You're welcome.
We spoke with Camille about lifestyle redesign. What are some other facets of occupational therapy?
Occupational therapy is a full-fledged rehabilitation profession. We might say that lifestyle redesign is a habilitation profession because people haven't necessarily lost skills. They just may need help with reorganization of skills. On this campus, the lifestyle redesign occupational therapists work with students who are having trouble organizing themselves, organizing time, who might have a lot of anxiety, might have some social anxiety, difficulty getting up in the morning and eating balanced meals, say, difficulty getting their exercise in while still being able to study. OTs can help them through lifestyle redesign really plan out to organize their specific days. And so some of the people on this campus might just be suffering some depression, some anxiety, some difficulty with organization. But in the health science campus, they also work with people who have weight management problems, and on this campus too, actually. Staff and faculty, members of the community with some weight management issues, with difficulties with eating issue, migraine. There's some conditions that are a little more clinical, like neurofibromyalgia, where people are having a lot of pain and difficulties in their muscles and joints. And the OTs who work with them to help organize their day, minimize stress in their lives, and maximize their potential to get out in the world and really live at their fullest capacity.
That's great. It sounds like it could be accessible for a lot of people. But what makes a good candidate for lifestyle redesign?
That's a good question. Lifestyle redesign candidates do need to be motivated for wellness. It takes a lot of work. If you're in a habit or a routine that maybe might not contribute to health, to switch to a really healthy lifestyle takes focus, concentration, takes dedication to get rid of those old habits like smoking cessation, and then to adopt healthy patterns of living. And so the lifestyle redesign practitioner, the OT, would really work in small groups or individually to focus on very specific functional goals.
So it sounds like you want to guide people to better, it's basically in the name, lifestyle redesign, to help them start fresh, I guess. So with that, what is occupational therapy exactly?
Yeah, so occupational therapy actually has been around since about 1917 and was created first working with patients in mental hospitals by psychiatrists, social workers, nurses, and people who realized that once people had a meaningful activity and occupation in their lives, they were able to balance their time, organize their thinking, plan in a kind of linear sequence rather than in a psychotic jumble, how to live again in the world. And so occupational therapists were trained in the early 1900s to work with, at first, psychiatric patients. When World War I started, it became quickly apparent that OTs could work with shell shock victims. Now we would call that PTSD. And find that functional rehabilitation at the front, actually, as well as soldiers returning home, would really help them regain kind of both their organization and ability to live life, calm their anxieties, decrease depression, and help them in their physical capacities as well. Well, doctors had created PTs to work with them on the physical rehabilitation. OTs and PTs started working side by side because a sort of integration of the whole person was able to come about through the confluence of these two professions, working PTs with the physical nature and the OTs with a little bit more of some of the metaphysical aspects.
Thank you so much for the basics of OT. Right now we're going to hit a break, but Dr. Kate is going to answer some more questions after the break.
Hi, I'm Dr. Larry Neinstein, current Executive Director of the Student Health Center and proud to be Executive Director of the Newengeman Student Health Center. We are going to be one of the largest student health centers now in the Pac-12, if not in the country. So we welcome you to come to our new resource room and any other components of the health center to see what we have in store for you.
Getting your prescriptions filled and refilled has never been easier. With the USC Pharmacy app on your iPhone, just snap a picture of your prescription and done. Whether you're picking up at the University Park Pharmacy or the Medical Plaza Pharmacy, your location will be notified of your refill request and begin processing your prescription right away. Just download our free app from the App Store and you're one touch away.
When it's time for lunch, a sandwich is a quick and easy choice. And with the right ingredients, it can be good and good for you. So I'm here today to see who can build the ultimate sandwich. All right, when the time is up, our judges will give you their scores. Ready, set, go! Okay, Jason starts out with a multi-grain roll. Ooh, Allison's stuffing her pita with, yes, spinach, a great source of iron. Jason isn't skipping on the protein, adding plenty of smoked turkey, like Allison's putting the finishing touches with crispy red bell peppers for a dose of vitamin A. Time! It looks like we have a tie. We'll need to call in our special guest referee.
Now these are what I call quick, delicious lunches. Whole grain breads, a whole variety of ingredients. There are so many different ways to build delicious, healthy sandwiches. These two get high marks in every category. I'd say you're both winners. America.
Let's get healthy together.
So how does one make occupational therapy a career?
Occupational therapists are really in demand, and so although it's not terribly widely known, it's not as common as PT, I think, in the general world. School counselors are getting better and better about referring students to OT. There's always a demand for OT, PT, speech therapist, and it's a wonderful profession because it's one of the recession-proof professions. And it's just great because it's so diverse.
That's unfortunate that not a lot of people know about it yet, but we're gonna get that.
Thanks to you, we're getting there.
Cool. So we're gonna ask Mindy, who's a student at the master's program, what made you interested in occupational therapy?
I actually took Kate's class. So I took OT 250, and I became really interested in what occupational therapy was. And the more I looked into it, the more I realized I kind of just need to see it firsthand. So I started volunteering at a clinic, at a pediatric clinic for sensory integration. And I fell in love with it, and I just realized this was definitely a profession that I needed to pursue. And yeah, I actually started as a sophomore into the program, and then I started my master's program my senior year. So I did a progressive degree from USC, and I've loved it. I've never looked back, yeah.
Cool. What are your future career goals?
So hopefully, I mean, this completely changes. There's so many different facets of OT that you can really just go into any different areas. So there's 3 different main practice settings that you could really be at, in like a mental health facility, in pediatrics clinics, or just centers and hospitals or rehab centers. I originally thought I wanted to go into pediatrics, but the more that I've worked with adults and older adults, I've realized that that's kind of where my calling is, I think, right now. So I'm hoping to work at a hospital and then work my way into a pediatric hospital and then possibly go into a NICU, but we'll see. I mean, who knows what will happen 5 years down the line. Right. But my interests are over there right now, so.
That's great. Every OT person that I've met so far seems very caring and passionate, so you can trust that when you get services that it's very well done. But why would one become an occupational therapist?
I think you have to have a calling towards service. The same reason that people might become a doctor, a teacher, a nurse, or a PT, OT, speech, those kinds of, there's really a calling towards service, towards working in the community or in hospital systems with people who have a need. The other thing about OTs is that we're very based in science, in neurology, so that there is a real calling. For me, there was a real calling to have a cross between nursing and teaching. And I worked in adult mental health and then sort of shifted into pediatrics later in my career, and then shifted into education even later. So it's long and very fulfilling. There's a lot of facets. You know, if there's someone out there in need throughout the lifespan, OTs can work with them.
I didn't realize that it has that neurological science background too. Yeah. That's very interesting. So why enter the occupational therapy program, particularly here at USC?
Well, Mindy, do you want to answer that?
We have the best program in the nation, so that's one of the things. But more than that, I just really felt compelled to be at USC because so many of the founders and a lot of different research are at USC, and so something like sensory integration, the founders were here at USC, really just pioneering SI and different other areas. So there was no other option, you know. It felt like the best way to go.
That is true. It gives you a lot of pride because the books and the articles that the students are reading are oftentimes authored by professors here in our department. So it's very much in the forefront of the national kind of consciousness about occupational therapy, drives a lot of both the research and the legislation. In fact, Florence Clark, who's our department head, is just finishing up a 2-year stint as the president of the American Occupational Therapy Association. So we are really leaders in this field.
Trojan pride?
Absolutely.
That's great. What's the difference between counseling and occupational therapy?
I think, we talked a little bit about the physical therapy differences, about PTs really work hard on the body and they're just great experts at kinesiology and balance and movement and endurance. And OTs have a lot more in terms of taking that, pushing it into activity and function. Same thing with counseling. That although we have our roots in psychology and psychiatry way back, and there's still a big branch of us that work in mental health, that is we are a doing profession, not a talking profession. So the psychologists can talk about some of the old roots of a behavior becoming dysfunctional. The OTs would mainly, especially lifestyle redesign, mainly deal with how you then translate that into function, how you get back into your everyday life, how your senses contribute to dysregulation, how you can help yourself minimize kind of the impact and the stress of our stressful living. In order to get on track and pursue the kinds of activities that keep you feeling whole. And so the mental health person, I do a thing called infant mental health, where I work closely with families and psychologists. So it even happens with babies. Working with families is really important, and that's true with adults, young adults here, and older adults, working with a whole system of care. So in an interdisciplinary way is really central to occupational therapy.
It seems like occupational therapy is very comprehensive in all these different realms, I guess. So where are some places that these counselors who have a degree would work? Where would they be? Where can we find them?
All over the place. There are occupational therapists in, as you said, NICUs, neonatal intensive care units, working with premature babies. I did a lot of work working in home health with infants and young children when they were first home and were unable to pursue those kinds of occupations that little infants and children have, like relationships and feeding and crawling and walking and talking and all those kinds of things that keep a child organized, as well as or helping them organize their sensory systems. Then schools, clinics, hospitals, SNFs or skilled nursing facilities with the aged. So it's really a birth through death continuum.
Wow. Could you describe how the mental and physical aspects of occupational therapy correspond with one another?
Sure. Now that we know the brain well, Antonio Damasio and Hannah Damasio here, the Neuroscience Institute, it's just cutting edge kind of work that they're doing, seeing that they can really see the correlation with every action, with every functional activity that we do is an emotional correlate. And so we have feelings about every kind of sensory input we take in. If you eat something, you know the smell, you know the taste, you know the last time you ate it, you know it's safe. If you eat something nasty, it's poisonous, you spit it out. There's an emotional reaction to that. So our everyday activities are generally always tied into an emotional response. So we have to work in a kind of coherent, holistic way with a body-mind continuum and really appreciate the significance that the emotions have in what might look like just a physical action. So in terms of rehabilitation, helping someone with, say, a spinal cord injury, it's important to deal with someone's emotions and their feelings about a loss that they had suffered from their earlier life and their earlier abilities, as well as dealing with the physical aspects of that. Both are important.
So there's recreational therapy and occupational therapy. So what's the difference between those two?
Recreational therapists are geniuses at activities. They don't have the kind of neuroscience background we have. So they wouldn't have a lot of the whole body neurology, kinesiology, some of the medical terminology and medical conditions that we're comfortable with in our training. Their training is far more geared at group activities, group dynamics, and which is fabulous. And again, in an interdisciplinary kind of way, OTs and rec therapists can work really well together because the occupational therapist can help adapt an activity to people with certain physical or mental compromises, and the recreational therapist can set up some sort of genius activity that can get everybody participating.
You've convinced me of like how great this therapy
is.
Come on in. As my last question, what would you say is the most important aspect of occupational therapy, or something that you'd like to share with our public?
Share with our public. I think this appreciation of the importance of the emotions to your functional everyday living, and to think about occupation as really happily living in the world. The kind of trademark for OT these days is living life to its fullest. And I think that that's a really healthy way to think about living your life, to really think about functional productivity, living your life to the highest capacity you can possibly live. And if you need to consult with an OT for a while about that, go for it. You can get a referral from a doctor here at the health center. You can get a referral from your family doctor if you need to. And then occupational therapists and you can get a partnership together to take it away.
I'm excited. Thank you so much for being here with us. Thank you, Mindy. Now we have a better understanding of what occupational therapy is, and with it, the tip of the day. Be proactive and ask your healthcare provider for OT referral.
Amen. Thank you.
You're watching Trojan Vision. For more of your favorite shows, check us out at TrojanVision.com and like us on Facebook.
Hi, I'm Dr. Larry Neinstein, current Executive Director of the Student Health Center and proud to be Executive Director of the Newengeman Student Health Center. We are going to be one of the largest student health centers now in the Pac-12, if not in the country. So we welcome you to come to our new resource room and any other components of the health center to see what we have in store for you.
Getting your prescriptions filled and refilled has never been easier. With the USC Pharmacy app on your iPhone, just snap a picture of your prescription and done. Whether you're picking up at the University Park Pharmacy or the Medical Plaza Pharmacy, your location will be notified of your refill request and begin processing your prescription right away. Just download our free app from the App Store and you're one touch away.